So good day everyone, my name is Michael Holtzhausen and I am a student nurse from the Doctors College, June H. So in this video, what I'm about to demonstrate here is to perform an open gloving, which involves a sterile gloves. So sterile gloves are used for performing procedures which involve direct contact with sterile body parts during surgical operations. This will serve protection of the hands and clothing of surgical personnel from microorganisms that are present in the patient or the environment. So, in performing the sterile gloving, first we need to perform hand hygiene. In my previous video, I've already performed hand washing from the soap liquid. So in this video, the alcohol may suffice. Then, we need to check if we have the correct size and correct type of gloves. So yes, it is a correct size and a correct type of gloves. We also need to examine the package if the gloves that we have is still intact, if it's dry or it may have water stains, and its expiration date. So it's good. And after we choose the appropriate gloves, we need to take it near that we need to work. Okay, next is to open the sterile packaging by peeling open the top seam and pulling it down. Open the sterile packaging without contaminating the inner package. Next is to remove the outer wrapper of the glove package by carefully separating and peeling apart sides. Okay, so this prevents inner glove package from accidentally and opening and touching the contaminated objects. So we need to grasp the inner package and lay it on a clean and dry flat surface waist level area. Sterile objects held below the waist is considered contaminated. So assuming that this table is on my waist level, so the sterile objects held below the waist is considered contaminated. Inner surface of the glove package is considered sterile. So we need to identify the left and right gloves. Each glove has cuffs approximately 5 centimeters or 2 inches wide. Must perform on the glove dominant hand first. So proper identification of gloves prevents contamination by proper fit. Gloving of dominant hand first improves your dexterity. So with the thumb and the first 2 fingers of the non-dominant hand, grasp the edge of cuff. With the thumb and the first 2 fingers of the non-dominant hand, grasp the edge of the cuff of the glove for dominant hand. Touch only the inside of the surface of glove. So the inner edge of the cuff will lie against your skin, and that is not considered sterile. So you must carefully put gloves over dominant hand, leaving cuff and being sure that it does not roll up the wrist. Be sure that thumb and the fingers are in proper spaces. There. With the glove dominant hand, slip fingers underneath the cuff for the second glove. Cuff protects your glove fingers. The sterile touching prevents the glove contaminations. After the second glove is on, interlock fingers of gloved hands and hold away from body above waist level until the beginning of the procedure. This is to keep your gloved hand safe from touching unsterile and contaminated surface. As what I did earlier, I carefully pull the second glove over the non-dominant hand. We must not allow the fingers and the thumb of gloved dominant hand to touch any part of exposed dominant hand. We need to keep the thumb of dominant hand abducted back. Okay, so for the glove disposal, we must grasp outside of one cup with the other gloved hand. We must avoid touching the wrist. Pull halfway down palm of the hand, place the thumb of the half ungloved hand and place it under the cup of the other glove. Contaminated area does not come in contact with the hands of the wrist. We pull the gloves off, turning it inside out. Discard in receptacle. So what I've done is to take the fingers of bare hand and tap inside remaining glove cup. Peels glove off inside out, and we must discard it in the receptacle. Proper disposal reduces the risk of infections, transmission, and contamination of the items. Hand washing reduces the spread of microorganisms. And we must perform hand hygiene. So that's all for the sterile gloving. So thank you very much for watching.